With 40 million cases worldwide, 1.1 million deaths, 8 million US cases, and over 217,000 Americans who've lost their lives to this pandemic, there's absolutely no question that COVID has upended the lives and families of millions. And it's also changed our society possibly forever. Today, I'd like to talk to you about some of the ways that the COVID pandemic is changing our healthcare system. Broadly speaking, COVID has forced many patients to obtain as much of their care as they can from home. The telehealth and virtual health visits over smartphones and computers have increased 42% during the pandemic. Medicare has also relaxed regulations that are allowing healthcare providers to be reimbursed for video visits at the same rate that they were being reimbursed for office visits. Programs such as Hopkins Hospital at Home, which is designed for certain patients who could be hospitalized, but instead are being treated at home, are gaining popularity. This type of program uses monitoring devices and close physician follow-up to deliver a hospital-level care at home while at the same time reducing costs by up to a third. Tech companies such as Amazon and Apple are offering telemedicine services to employees, as well as apps that download a patient's electronic health records. Nursing homes are also changing. Regulators are requiring timely COVID case reporting, creating mandatory testing plans, as well as infection control measures. There's also renewed discussions around a nationwide long-term care insurance program that pays for care at home. There are also over 100 COVID vaccine candidates with companies such as Johnson & Johnson and Moderna in phase 3 trials. Many of these vaccines are RNA-based, which is a relatively new type of vaccine that can be developed faster than previous ones. And COVID has also exposed more economic and technological divides in society. There's one study that found that a third of people making less than $25,000 per year have access to telehealth, whereas nearly 70% of those making over $100,000 a year do. With cases surging in the US, the pandemic is not going away anytime soon. But despite the massive disruption that this has had in our lives and in our economy, COVID-19 has also ushered in some unique challenges in the healthcare system that may result in more efficiency, novel vaccine processes, as well as renewed care from home.